Good morning, student. So, today we will start lecture of the ophthalmology. It is a part of the surgery. In the yesterday's lecture, we was learn about the purulent uveitis, then endophthalmitis, panophthalmitis. Fourth is the specific clinico-etiological types of non-suppurative uveitis, then acquired syphilitic uveitis. Sixth is the leprotic uveitis. Seventh, that is uveitis in non-infectious systemic diseases. Eighth, Becket disease. Ninth is a uveitis in arthritis. 10th, that is parasitic uveitis, and 11, that is the fungal uveitis. So all these topic we was learned in the yesterday's lecture. So today's lecture we will start with the candidiasis. Candidiasis, it is an opportunistic infection caused by a Candida albicans. It occurs in immunocompromised patients, which include the patient suffering from AIDS, malignancies, those receiving the long-term antibiotics, steroids, or cytotoxic drugs. Patient with the long-term indwelling intravenous catheter used for hemodialysis and the drug addicts are also prone to such an infection. So, candidiasis is the infection caused by the Candida albicans, and it occurs in immunocompromised patients like AIDS, malignancy, and due to the long-term using of antibiotics, steroids, and cytotoxic drug. And in case where there is intravenous catheter for the long time used for the hemodialysis and drug addict are also prone to the candidiasis. Then viral uveitis. Uveitis in herpes zoster ophthalmicus. In that uveitis herpes zoster ophthalmicus, that is HZO, is the involvement of ophthalmic division of the fifth nerve by the varicella zoster anterior uveitis varicella zoster virus. Okay. Then anterior uveitis develop in 40 to 50% cases with herpes zoster ophthalmicus within 2 weeks of the onset of the skin rash. So, the herpes zoster ophthalmicus is the involvement of ophthalmic division of the fifth nerve by the varicella zoster virus. So, it is called as a viral uveitis. In that, anterior uveitis develop in 40 to 50% cases. With this herpes zoster ophthalmicus within the 2 weeks of the onset of the skin rashes. So, when there is a skin rashes within the 2 weeks of these rashes, there is in 50% cases anterior uveitis develop, which results in a herpes zoster ophthalmicus. A typical herpes zoster ophthalmicus keratitis may be associated with the mild iritis, especially in a patient with a vesicular eruption on the tip of the nose. So, it is mostly seen in a patient with vesicular eruption on the tip of the nose with mild iritis. Then, a simplex herpes simplex. It is associated with keratitis in most of the cases. It may be seen in association with dendritic or the geographical corneal ulceration or with the deciform keratitis. Rarely, Anterior uveitis may occur even without keratitis, and it is a mild grade of non-granulomatous iridocyclitis which is excited by the hypersensitivity reaction. So, in the herpes simplex uveitis is associated with keratitis in most of the cases, but it may be seen in association with dendritic or geographical corneal ulceration with deciform keratitis. And rarely, anterior may occur even without keratitis. It is a mild grade non-granulomatous iridocyclitis which is excited by hypersensitivity reaction. Then, cytomegalic inclusion disease. That it is a multisystem disease which is caused by a cytomegalovirus, that is CMV, and it occurs in two forms, that is congenital and acquired. So, cytomegalic inclusion disease is caused by the cytomegalovirus and it is in two forms, congenital and acquired. Then next is a lens-induced uveitis. In that there is a phacoanaphylactic uveitis. Phacoanaphylactic uveitis is an immunologic response to the lens proteins in the sensitized eye presenting as a severe granulomatous anterior uveitis. So, it is an immunological response of a lens protein which are sensitized eyes presenting in the sensitive person that have sensitive eyes which presenting as a severe granulomatous anterior uveitis, and the disease may occur following extracapsular cataract extraction, trauma to the lens, or leak of the proteins in hypermature cataract. So, this disease occur following extracapsular cataract extraction, trauma to the lens, or leak of the protein in hypermature cataract. The clinical feature of this phacoanaphylactic uveitis is that these include a severe pain. There is a loss of the vision with the mark congestion and signs of granulomatous iridocyclitis, which is associated with the presence of lens matter in the anterior chamber. So, the phacoanaphylactic uveitis include severe pain, loss of vision, and mark congestion. And the signs of granulomatous iridocyclitis, which is associated with presence of lens matter in the anterior chamber. Then, phacotoxic uveitis. It is an ill understood entity. This term is used to describe a mild iridocyclitis which is associated with the presence of lens matter in the anterior chamber, either following the trauma or extracapsular cataract extraction or the leak from hypermature cataract. The uveal response due to direct toxic effect of lens matter or the mild form of allergic reaction is yet to be ascertained. So the phacotoxic uveitis shows it is an ill understood entity, and this term is used to describe the mild iridocyclitis associated with response of a lens matter in the anterior chamber, either the following trauma or extracapsular cataract extraction or the leak from hypermature cataract. The uveal response due to the direct toxic effect of lens matter or a mild form of the allergic reaction to 8B acid. Then Fuchs uveitis syndrome, that is FUS. So this FUS, that is Fuchs heterochromic iridocyclitis, is a chronic non-granulomatous type of low-grade anterior uveitis. It is typically unilateral in middle-aged person, and the disease is characterized by heterochromia of iris, then diffuse stromal, diffuse stromal iris atrophy, 5 kps at back of the cornea, faint aqueous flare, absence of posterior synapse, a fairly common rubeosis, rubeosis iridis, sometimes associated with neovascularization of the angle of anterior chamber, and last one is comparatively the early development of complicated cataract and secondary glaucoma, which is usually a open angle type. So, the Fuchs heterochromic iridocyclitis is a non-granulomatous type of low-grade anterior uveitis, and it is typically occur unilaterally in the middle-aged person. So, this disease is characterized by heterochromia of the iris, then diffuse stromal iris atrophy, fine KPS at the back of the cornea, faint aqueous flare, absence of posterior synecdoche, a fairly common rubeosis iridis, sometimes associated with a neovascularization of angle of anterior chamber, and comparatively the early development of complicated cataract and secondary glaucoma, usually open angle type. So this is all about the Fuchs uveitis syndrome. Then the degenerative condition of the uveal tract. The degeneration of the iris, in that there is a simple iris atrophy, essential iris atrophy, and iridocytis. So B, that is degeneration of the dystrophies of the choroid, in that first one is primary choroidal degeneration, then senile central atrophy, second is the central areolar choroidal atrophy, Third one is essential grade atrophy, and fourth is choroideremia, and fifth that is mycopic choroidoretinal degeneration. So, the degenerative condition of the uveal tract shows the many types. In that first one is a degeneration of iris. In that three types, that is simple iris atrophy, essential iris atrophy, and iridocyclis. And in the B, that is degeneration of the choroid. In that first one is a primary choroidal degeneration. Then senile central choroidal atrophy. Second is the central areolar choroidal atrophy. Third is the essential grade atrophy. And choroideremia. And fifth one is a myopic choroidoretinal degeneration. In that, in secondary choroidal degeneration, it occurs following the inflammatory lesions of the fundus, and it is characterized by a scattered area of choroidoretinal atrophy and the pigment clumping. Ophthalmoscopic picture resemblance retinitis pigmentosa, and hence also labeled sometimes as the pseudo-retinitic pigmentosa. So, the secondary choroidal degeneration occurs following inflammatory region of the fundus. There is an inflammation of the fundus which is characterized by the scattered area of choroidoretinal atrophy and the pigment clumping. So, in this, when there is an ophthalmoscopic picture resemblance retinitis pigmentosa, and hence also labeled sometimes as a pseudo-retinitic pigmentosa. Okay. Then the tumors of the uveal tract. In the tumor of the uveal tract, which are classified into the three types, that is tumor of the choroid, sorry, then tumors of the ciliary body and the tumors of the iris. The tumor of the choroid shows a benign, that is first one is a nevus, second is hemangioma, third one is a melanocytoma, and fourth is a choroidal osteoma. And in the B there is a melanoma. So these are the tumors of the choroid. In that benign, that is nevus, hemangioma and melanocytoma, and fourth one is a choroidal osteoma. And B, that is malignant melanoma. In that there are second type of the tumor of uveal tract, that is tumor of the ciliary body. In that first one is a benign. In the benign there is a hyperplasia, benign cyst, medulloepithelioma are included. And in the malignant there is a melanoma is present. Third one is the tumors of the iris. In the tumor of the iris, there are again two types. There are benign and malignant. In the benign, there is a nevus benign cyst, then nevoxanthoendothelioma, and in malignant tumor of the iris, there is a melanoma. So these are the types of the tumors of the uveal tract. Then in a detail, when we see about the tumors of the choroid, first one is the nevus. It is a commonly occurring asymptomatic lesion, usually diagnosed on routine fundus examination, and it typically present as a flat, dark gray lesion with a feather margin and usually associated with overlying colloid bodies. Once diagnosed, it should be followed regularly, and since it may undergo malignant change, which is evidenced by increasing pigmentation or height of the nevus, then appearance of the orange patches of lipofuscin over the surface, and third one, that is appearance of the serous detachment in the area of the nevus. So, nevus is a commonly occurring asymptomatic lesion, usually diagnosed as the routine fundus examination and typically present a flat, dark gray lesion with a feather margin and usually with the overlying colloid buds. So it is diagnosed as it shows when undergo the malignant changes which is evidenced by increasing pigmentation. When there is a pigmentation is increased or the height of the nevus is increased with the appearance of the orange patches of lipofuscin over the surface, and there is the presence of serous detachment in the area of the nevus which is diagnosed as a malignant changes. Then choroidal hemangioma. So it occurs in the two forms. That first one is a localized choroidal hemangioma. It presents as a raised dome-shaped salmon's pink swelling, usually situated at the posterior pole of the eye, and overlying retina may show a serous detachment, cystoid degeneration, and the pigment epithelium molding. So, the fluorescein angiography is usually diagnosed. Diffuse choroidal hemangioma. It is seen in association with a Sturge-Weber syndrome and causes a diffuse deep red discoloration of the fundus. Then melanocytoma. It is a rare tumor which presents as a jet black lesion around the optic disc, and choroidal osteoma, that it is a very rare benign tumor which is present as elevated yellowish orange lesion in the posterior pole, and it typically affects the young woman. So this is all about the choroidal hemangioma, and in that there are two forms, that is localized choroidal hemangioma and the diffuse choroidal hemangioma. Then we have studied about the melanocytoma, which is rare tumor and present as a jet black lesion around the optic disc, and the choroidal osteoma, that is very rare benign tumor and present as elevated yellowish orange lesion in the posterior pole, and it typically affect the young woman. Then, a malignant melanoma of the colon. It is the most common primary intraocclusion intraocular tumor of adult and usually seen between 40 to 70 years of the age, and it is rare in black and comparatively more common in the white. So, it arises from the neural crest and derive a pigment cell of the uvea as a solitary tumor and is usually unilateral. So, when we study about the pathology, that is gross pathology, this malignant melanoma of the choroid. It is the tumor and it may arise from the pre-existing nevus or the de novo from the mature melanocyte that is present in the stroma, and it may occur in the two forms, that is circumscribed pedunculated tumor and diffuse, that is a flat malignant melanoma. So the malignant melanoma of the choroid is mostly common primary intraocular tumor of the adult and seen between 40 to 70 years of the age, and it is rare in the black and common in the whites. So it arises from the neural crest, which is derived a pigment cell of the uvea as a solitary tumor and is usually unilateral. So these tumor when arises from a pre-existing nevus or the de novo from the mature melanocyte present in the stroma, it may occur in two forms. That is, first one is a circumscribed pedunculated tumor, and second that is diffuse or the flat malignant melanoma. Then, when we study its histopathology, the microscopically uveal melanoma are following four types. First one is a spindle cell melanoma. Second is the epithelioid cell melanoma. Third, that is mixed cell melanoma.